Good evening. Welcome to Feet Forward with the Illinois Podiatric Medical Association. My name is Chris Martin, and I got the pink shirt on today because it's one of the first days of spring. So
Very
we're
sharp.
welcoming in spring, and that's a good segue to what we're going to talk about tonight. We're going to talk about walking. Every April, this is now the second year in a row, the IPMA has had a Keep Illinois Walking campaign. And with me tonight is Dr. Jesse Placentia, who's a podiatrist who practices in Chicago. You're a graduate of the Osteopathic Medical University and Podiatry School in Des Moines, Iowa, right?
That's correct.
Okay. What was it like in Iowa when you were practicing there?
All the corn you could eat. It was a beautiful place. Very peaceful, tranquil, great place to study, great place to learn, and I enjoyed it a great deal.
But now you practice in an urban setting, so it's much different. You have a heavy Latino population, right?
Yes, I do. Yes. Okay. It helps to be fluent in Spanish, and the Latino population appreciates that greatly.
Que bueno.
Que bueno. Muy bueno.
That too. So we talked about the walking campaign, and last year the Illinois Podiatric Medical Association offered free pedometers to people that were interested in starting a walking campaign as a way to become more fit, be more active, and maybe shed some of those pounds that sort of accumulate over the winter. We all kind of experience that a little bit. So we're going to do it again this year. Now, you participated in the program last year. Tell me a little bit about your experience with the pedometer campaign last year.
Yeah, it was a great campaign, and one that I wasn't familiar with or even sure how it would work. And we were giving out at least a dozen of these to each patient who was interested. And it's a very basic pedometer, which just keeps tab of the number of steps. And the encouragement was to walk 10,000 steps a day, which was the target for optimum health, for generating good muscle tone, weight loss, and things like that, along with all the other good things that walking brings.
Great. Now, as I understand it, we're going to be shipping out about 6,000 pedometers to members of the Illinois Podiatric Medical Association who are participating. That comes to about 10 or 15 pedometers per member. And what we'd like people to do is we'll flash up the 800 number so people can see it. All you have to do is call the 800 number or visit the website. It's a newly designed website. It's very cool looking. There's a nice little button there for referrals. So all you have to do is go to the website or call the 800 number. We will give you 3 or 4 podiatrists near your zip code, and you can choose which one you want to go to. And they're all the ones that we'll be giving you are all participating in the pedometer program. So you can just make an appointment or stop by the office, whatever you want to do. You'll get a pedometer. You'll get some information about walking and how to start a fitness campaign, and it'll sort of get you on your way. It'll be that gentle nudge that we all kind of need every once in a while to start an exercise program, right?
Very true. And they go like hotcakes, so I wouldn't hold out very long.
That's
because
right.
The patients that we did hand them out to wanted the freebie, but more than that, I encouraged them to be accountable, to keep track of how many steps they were doing, keep track of how much weight they've lost, and I think they really enjoyed it when they became an active participant.
Did people sort of tell you later on that they were wearing it? And
yeah.
Yeah, and did people do well with it?
They did great, and the problem was they had a tendency to slip off if you're not careful or you forget you have them on, and some of these patients would come back and want another one. I'd just send them out, have them purchase a low-cost one, and they're available almost in any health store, and they loved it tremendously.
Now, this year, the IPMA is going to do something a little different. In addition to the 800 number and the website, we will be taking tweets from people who are on Twitter. So if you're on Twitter, you know what I'm talking about. I don't have to explain it. Just send us a little tweet to IPMA. We are on Twitter, so we'll be happy to take your requests. We'll get you some referrals right away. And it's sort of a newfangled way to reach a new audience of people in Illinois who might have foot questions. So that's what we're all about, dispensing good foot care information.
Sure.
So with walking campaigns, especially people who have been a little bit sedentary in the wintertime, when they're just starting that campaign for the first time, that exercise regimen, the common advice is always consult a physician before you begin an exercise program. I'm not really sure how many people actually do that. But for the people that would have questions about what kinds of things should they be looking for, or what kind of questions should be asking themselves, or what kinds of things do you look for and advise your patients who are starting a program?
Well, first and foremost, it is a good idea, especially if you're, say, over 60, or if you haven't been active in any kind of exercise program, or if you happen to have any particular health issues, such as diabetes, heart disease, circulatory problems. All of those patients can participate in a walking campaign. And it's important to get assessed and see if there's any limitations in your motion, if you've had any aches or pains, which we realize that pain is not a normal finding. You should never have to experience pain necessarily when you're walking, or at least get a diagnosis for what's causing that pain. And there's a number of things we can do to help control that and to make the walking more enjoyable.
That's great. So, what are some of the things that, in terms of equipment, for instance, because a lot of people want to go out and buy a new pair of shoes, workout clothes, and get the latest and greatest shoes. But what do you advise your patients on?
Well, after a thorough exam, or if you've examined yourself, and actually some of the shoe stores will discuss your physical needs, whether you want to walk a mile or do you want to walk 26 miles. Do you want to walk and then run? So based on your personal needs, I look at the type of foot they have, whether they have structural or balance problems, if they have any metabolic problems versus physical problems such as bunions, hammer toes, heel pain, and other dermatologic problems such as athlete's foot, corns and calluses. Do they have fungus in their toenails? Do they have ingrown toenails? All these things can be remedied initially so that their walking program can be more successful.
Are there certain kinds of patients that you recommend not sort of dive into an exercise program?
Sure. And we have to be careful with our diabetic population, because especially those who experience neuropathy or some loss of sensation in their feet, they can actually do more damage than good. They can suffer from blisters, which can lead to infections and possible ulcerations and amputations, which could be deleterious to their overall health. So those patients we look out for. Arthritic patients, and a lot of people start to experience arthritic changes early on, 30, 40 years old. People have worked all their lives on their feet who have some, say, knee problems or hip problems. Even though we treat primarily the foot and ankle, we can recognize how these other problems will impact their ability to walk and enjoy a walking program.
Now, you brought a foot model with us, with you tonight. So why don't you hold that up and sort of show our viewers when the foot goes through the walking process, what kind of impact and force is actually going on? And this is really a very delicate sort of instrument when you think about it, but yet it bears the entire burden of the whole body, right?
And absolutely, Chris. And these have to last you your whole lifetime, and you only get a couple per person. So, 26 bones, dozens of muscles and ligaments that insert, and even a tiny imbalance can cause a host of problems. Tendon problems, arch problems. Common thing is heel pain, which affects this long ligament in the bottom of the foot, which can lead to heel spurs and pain on waking up and pain after standing for long periods of times. So if this foot is not dynamically balanced, say the arch is too low or the arch is too high, any extreme in the foot structure can cause problems. There's really no such thing as a normal foot. People say, "Oh, I wish my feet were normal." Well, most of the patients I see don't have normal feet, but we can help them function better. We can make that foot work better for them. And the walking campaign is just the first step in doing that, by helping people lose weight, helping them be more active, helping them to, just become more involved in their overall health.